Chemotherapy, mesothelioma treatment information. Malignant mesothelioma chemotherapy treatment uses anti-cancer drugs to eliminate cancer cells. There are roughly 50 different drugs that are used independently or in combination to treat cancer. A handful of these drugs have been found to help increase survival times in malignant mesothelioma patients. Overall, chemotherapy is not ultimately a highly effective treatment for mesothelioma. At this point, no standalone mesothelioma treatment has had great success against the disease. Combining surgery with either chemotherapy or radiation therapy in treating malignant mesothelioma has yielded the best chances of increased survival. This is especially true when mesothelioma is discovered early in its development. How chemotherapy treats malignant mesothelioma. Chemotherapy drugs interfere with malignant mesothelioma cancer cells' ability to divide and reproduce. Instead, the cells become damaged and die. Because chemotherapy drugs flow through the bloodstream, they reach cancer cells all over the body. These drugs are also toxic to healthy tissue, so chemotherapy must be planned so that it slowly kills the cancer and not normal cells. Following successful chemotherapy, the normal tissue will recover, but the malignant mesothelioma cells will not. Chemotherapy drugs are given in many different ways. The manner in which you may receive mesothelioma treatment will vary according to the types of cancer and the drugs you are taking. The most common method of delivery is by injection into the vein. Less commonly used methods include oral tablets, muscular injection, or subcutaneous under the skin injections. Chemotherapy administration, intravenous injection. In intravenous injection, the mesothelioma treatment drugs are often diluted with liquid and delivered from a bag via a drip into a vein in your hand or your arm. Another method of delivery is to insert a plastic tube directly into the vein in the chest. Two potential problems with the intravenous method are the risk of the tube blockage and infection. The plastic delivery tube should be flushed with a heparin, a drug that prevents clotting, about once a week. You will be able to do this yourself. Intravenous chemotherapy is given over a period of time, usually ranging from half an hour to a few hours or sometimes a few days. Infusion pumps. A fairly new and increasingly common method of delivery is the infusion pump. The pumps are portable and are used to deliver a controlled amount of the drug into the bloodstream over a period of time. This means you may take your mesothelioma treatment at home and make fewer trips to the hospital. Chemotherapy. Even though chemotherapy can cause unpleasant side effects, some people still manage to lead normal lives. Sometimes chemotherapy can actually make you feel better by alleviating the side effects of the cancer. Unfortunately, the drugs can affect normal cells as well as malignant mesothelioma tissue. This can cause many unpleasant side effects. Not all chemotherapy drugs cause the same side effects, and some people may have very few side effects. Cancer treatments produce different reactions in different people. Reactions also vary from treatment to treatment. It should be remembered that nearly all side effects are only temporary and disappear once treatment has stopped. Body parts that may be affected by chemotherapy and malignant mesothelioma treatment are those whose normal cells rapidly divide and grow. These areas are the mouth, digestive system, skin, hair, and bones. If you would like to know more about chemotherapy side effects or additional malignant mesothelioma information, ask your doctor. Although the side effects of chemotherapy can be severe, they should be weighed against the benefits they can produce. Remember, if you are feeling violently ill, your doctor may be able to prescribe other drugs with fewer or less potent side effects.